Welcome, everybody, to our webinar today for consumers. And today's topic is going to be gearing up for flu season. I'd like to first introduce our friends and our partners from My Personal Bookkeeper, Jackie Mellinger, co-owner, and Lisa Lipton, Community Outreach and Development Manager.
Thanks, Barbara. It's great to be here. Good morning, everyone. As Barbara said, I'm Lisa Lipton, the Community Outreach and Development Manager at My Personal Bookkeeper, and I'm joined today by our owner, Jackie Mellinger. Thank you so much for taking some time out of your day to join us for the first in Elderwerks Ask a Nurse series, gearing up for the flu season. We're really happy to be here and happy to sponsor. Before we begin, I'm going to give you a little background on our company, My Personal Bookkeeper. We provide our clients with help managing their day-to-day financial and household affairs. Roughly 80% of our clients are seniors with either some type of physical or cognitive deficit, but we also help clients going through some type of transition, whether they're moving or downsizing, possibly going through a divorce or recently widowed, recuperating from a surgery, or in some cases, just busy professionals who don't have time to take care of everything. Typical services we provide include bill paying, opening and reviewing mail, organizing files. We help manage insurance and account statements and claims, so we'll review any credit card statements and make sure that there's no erroneous charges on there. If there's any issues with insurance claims, we can help by contacting whether it's Medicare, the insurance company, or the doctor's office. We also work with our clients' professional partners, whether it's an accountant or a lawyer, helping to organize documents, possibly for tax returns, or if someone's doing some estate planning and they need their documents organized, we'll make sure that they get to the professional in an organized, timely fashion. But the bottom line is all of our services are customizable based on the client's needs. And we provide our services through client advocates who truly do advocate for the client. They're always looking at the details to make sure that no one's getting taken advantage of, whether, again, it's their credit card statement, if there's charges on there that shouldn't be. So they really do look at all the details, and they come from various professional backgrounds. They're bonded and insured, and they work directly with the clients in their homes. Obviously, the last few months have been a little challenging and we've worked remotely, but fortunately, many of our services can be done remotely, whether it's bill paying or reviewing accounts. And our advocates can and have used FaceTime or Zoom with clients. So that's not an issue. And of course, our advocates are backed up by a dedicated, experienced team, which include our owners, Jackie and Mike Mellinger, who've been in the senior care industry for over 20 years.
Wonderful. Thank you, Lisa. Jackie, did you have anything you wanted to say?
I think she hit on all the important points, but we're happy to be here and we're looking forward to hearing the information today.
Wonderful, wonderful. Before I introduce Chris, I just want to talk about Elderwerks for a little bit. We are a not-for-profit organization that provides complimentary assistance to seniors and their families. We can help with senior living, home care, or referrals for other support services. If you need assistance or support or know of any seniors who need help, we would be happy to assist. I also wanted to mention that today's session is being recorded. So thank you very much, and I would like to go ahead and introduce Chris Petrik, our Elderwerks a friend and nurse of really over 40 years. We're very lucky to have her here. So without further ado.
Barbara. Hi, as Barbara said, my name is Chris Petrik, and I'm the training specialist for Elderwerks. I'm also a registered nurse with over 40 years experience in various specialties at the bedside, outside in the community, and in education. I'm going to go ahead and get rid of myself since I introduced myself, and let's see if I can do that. There we go. So I'm going to go away so you can see the whole screen. and we'll go ahead and get started. So this is the first time we're doing this. So you're with this, you're on this Virgin Voyage with me. And this is a program that I actually started at one of the communities for the people in independent and assisted living, and they seem to have liked it. So we thought we'd try it with Elderwerks, and our program is called Ask the Nurse. During this 30 minutes live program, you will be able to choose the topic to discuss. So at the end of our 30 minutes today together, I will ask the people in the audience to put a topic in the chat box. I will select a topic out of those suggested, do my research, tell you what I know about them that topic next time we meet. So it'll give me, and we're meeting every month, the second Thursday of every month. So since today's the first one and we weren't able to capture any of your requests, I chose immunizations since flu season is just starting. And so we're going to talk about not only flu season, but the different immunizations that will also be important for older adults. So the three that we're going to address today is our annual influenza, our shingle vaccine, and called herpes zoster, and commonly, which is commonly called shingles, and then the pneumonia vaccine, which is Pneumovax. So just to kind of, and I know you know some of this stuff, but it's just a good review. Flu and the common cold may sound the same, but they're very different. The common cold is caused by many variations of the virus, so which is why we don't have a vaccine for the common cold. There's so many different variations of the common cold that you know, you might become immune to one of the common cold viruses, but not everyone has the common cold, the same one that they had maybe 6 months ago. The onset for influenza is sudden, and not everyone who has the flu will have a fever. This is where it's going to get a little tricky because some people will have a fever with the flu, and we know with COVID-19, people do get the flu. But with common influenza, you usually recover in about 2 weeks. Some people during that recuperation period will go on to develop pneumonia, which is a common complication from the flu. Other complications with influenza is complications with heart and lung. You know, being sick, if you have a cardiac problem, does put a lot of stress on the heart. And so if you have underlying heart problems, either you know or you don't know about, they may, the common flu may exacerbate those problems. Also, like I said, it's not unusual, particularly in the older adult group, to develop pneumonia after influenza. Influenza changes strains every year, and there's about 100 different satellites or places around the world that study the flu, in Japan, in Beijing, in the United States, in Australia. And so all these people look at those viruses that are out there, and that's how they kind of come to a common denominator about what is going to be prevalent in our influenza shots annually. Sometimes they're right on, and sometimes they're not. It's a very educated guessing game. And but what it does, and this is what I tell people, what it does is if you get a flu shot and maybe that flu shot didn't include that virus that it kind of came out of left field, that sometimes your symptoms will be less, and it's boosted your immune system. So it still does have somewhat of an advantage. Influenza A virus is the only influenza virus known to cause flu pandemics, which are global epidemics of flu disease. And a pandemic can occur when a new and very different influenza A virus emerges that both infects people and has the ability to spread efficiently between people. Influenza type C infections generally cause mild illness and are not thought to cause human flu epidemics. And then influenza D viruses primarily affect cattle and are not known to affect people. And then B viruses also are known as part of the flu epidemic, the disease of the flu season. And so we see, we see categorically that influenza A and B are the influenza strains that we see every year. But again, strains can change yearly. I remember one year, and I get my flu shot every year, it was May. And out of the blue came this influenza strain, and I happened to have gotten that strain. It was not in the influenza shot, and I was pretty sick that year. So sometimes, like I said, it will help you, and maybe I would have been sicker, I don't know, but got my flu shot. But unfortunately, the strain that came out of left field in very early spring was not anything that was included in the influenza vaccine. So we do know that the strains can change yearly. There is an immunization specific to older adults, and I urge older adults to make sure that they're asking for that. Last year, I was still working full-time at my community, and we were given flu shots, and so I got one. They didn't have the adult strain, and I thought, I don't need it. And big mistake on my part, lesson learned, because I ended up developing influenza B. And so what I found is that the influenza for the senior population has 4 times antigen in it. So it definitely protects you. And it was interesting because my husband went to Osco and got his flu shot, and he did get the senior dose. And even living in the same household with me when I had influenza, he did not get the flu. So the one thing that I really always want to emphasize is you cannot get the flu from the flu shot. It is not a live virus. Now, a lot of us have lived through swine flu, and we know that during that epidemic, that virus was live. And so when the virus is live, there is a possibility that you can get the flu from the flu shot. But it's not live anymore. And science has learned to kill that virus and still make it an antigen where, it's where it creates antigens in our body. So you cannot get the flu shot or flu from the flu shot. Here's typically what happens. So you and I are together, and I have the flu virus, but I'm not showing symptoms of it yet. But even though I'm not showing symptoms of it yet, I'm still shedding it, okay? So you and I are together, I feel fine today, but I'm shedding the flu virus because I've already got it working in my body. I leave you, I go home and I get sick, I start showing symptoms. You drive yourself to Osco and you get a flu shot, and about 24 hours later, you end up getting the flu. And that's because your flu shot doesn't build the antigens, doesn't build the antibodies, I should say, in your body for about 2 weeks. It just so happens that since you were exposed to the flu, and since your body hadn't built that immunity yet, you're still going to get the flu. Okay, so it takes about 2 weeks for you to build those antibodies. But it coincides with you getting a flu shot, so guess what? You think you can get the flu from the flu shot, but you really cannot. Now here's some symptoms of the flu: fever or feeling chills and feverish, a cough, a sore throat, a runny or a stuffy nose, muscle or body aches, fatigue, and some people may have diarrhea, though it's more common in children and infants than it is in adults. And also I want to distinguish that when some people say they have the flu, they have gastroenteritis, which has nothing to do with upper respiratory. That's the other thing people confuse, is they get a flu shot and then a week or 2 down the road, they get gastroenteritis because they've been exposed to someone who has that virus, and it's what we call the stomach flu. And again, they say, I got the flu from the flu shot, which you didn't. The flu shot does not cover you for gastroenteritis or the stomach flu. It only covers you for the respiratory flu. Influenza vaccine, the one that you want to get as an older adult is called Fluzone. It's a high dose and it's recommended for people 65 and older. Like I said, it has 4 times the amount of antigen in it, so it's going to help you build those antibodies. And it usually protects you against 3 to 4 types of flu. And again, over those hundreds of sites that are working continuously year-round to see what kind of flu is out there last year and what's kind of moving around in different communities, it really will look at 3 or 4 and we can't put everything in the flu shot. Data collected from 2012 to 15, the flu vaccine among adults reduced the risk of being admitted to the ICU by 82%. Flu vaccine decreases the risk of some cardiac events, even if you have heart disease. It decreased the risks of pneumonia. It decreased the hospitalization of people with diabetes or chronic obstructive respiratory syndrome. People that received the higher dose had 24% fewer hospitalizations than those that received the regular dose. And so again, they work all year round looking at the different types to make sure that we're getting it right. But again, it's an educated guess. We'll talk about pneumonia. And pneumonia is caused by the Streptococcus pneumoniae bacteria or pneumococcus. And it can cause many types of illnesses. Some of these illnesses can be life-threatening, and that is pneumonia. Pneumonia is an infection of the lungs that can cause mild to severe illness in people of all ages. Vaccine can prevent some types of pneumonia. You can also help prevent pneumonia and other respiratory infections by following good hygiene practices. Again, if you're sick, you need to wear a mask. You need to wash your hands. And you know, COVID has really brought to light hand washing. Unfortunately, what concerns me is once we get a vaccine for COVID, many people will go back to their poor hygiene techniques, like not washing their hands. And we should be washing our hands all the time. And the hand sanitizers are wonderful, but what really gets rid of all the bacteria all of the time is hand washing. And just to kind of segue before we finish pneumonia, hand washing is always the #1 defense against any infection. You should be washing your hands for 20 seconds. You should be using soap and water. And warm water is, the preferred temperature. You should be rinsing. When you rinse, you should be rinsing up so the fingertips are facing up and the drops will go to your wrist. And when you're drying, you should start at the wrist and move forward. If you're blow drying your hands in a public bathroom, ooh, I hate those because they just blow the bacteria around the room. Or the virus around the room, but make sure that you are exiting that public bathroom by, if there's no towels, you can't leave without touching that doorknob, but make sure you're using your hand sanitizer the minute you leave that bathroom. Many viruses have kind of an oily coating to them, and they know for sure COVID does. It's kind of got a fat molecule kind of surrounding it. And so when you use soap on your hands, it kind of makes that virus slippery, and that's what removes it from your hands. So it's the friction, rubbing your hands back and forth, and the soap and the time. So those 3 things are extremely, extremely important. Public bathrooms are a cesspool for bacteria. If you have paper towels, you should be using a paper towel to turn the handle of the water off and using a paper towel to open the bathroom door. But many public bathrooms have gone to those air dryers. So anyways, my little soapbox for hand washing. Viruses, bacteria, and fungi can all cause pneumonia. There's bacterial pneumonia and there's viral pneumonia. The difference between them is bacterial pneumonia can be treated with an antibiotic. Viral pneumonia, you use more supportive. There's not an antiviral for pneumonia. So that's the difference. What happens though is many viral pneumonias will start out as viral, and then as the body's trying to fight that off, it'll create bacteria, and some people go from viral to bacterial. So that's why sometimes they'll add an antibiotic and sometimes they don't. But viral pneumonia is the one that you really are using just supportive. Fungi can cause a pneumonia too, and we usually get that from working in the soil. So that's something you see more in farming communities. In the United States, common causes, of viral pneumonia are influenza and respiratory syncytial virus, which is RSV, which you usually see more in children. A common cause of bacterial pneumonia, like I said, is Streptococcus pneumoniae. Clinicians are not always able to find out what germ caused someone to get sick with pneumonia. So that is the difficult one to treat if we can't, pinpoint it and figure out what's going on. There's different types of pneumonia, classifications of pneumonia. We know that pneumonia bacteria is usually spread person to person by direct contact, respiratory secretions, saliva or mucus. And many people, especially children, have that bacteria in their nose or their throat at one time or another without becoming ill. Doctors call this carriage and do not know why it rarely leads to sickness. Kids obviously have a different immune system. It's just developing, so it's a little bit different than ours because it's a little suppressed. So there's an extra protection in there for what happens in the nose. But community-acquired pneumonia is when someone develops pneumonia in the community, not the hospital. So you're going to a restaurant, you're going to the senior center. That's where you can pick up community-acquired pneumonia. Healthcare-associated pneumonia is when someone develops pneumonia during or following a hospital stay in a healthcare facility. Healthcare facilities include hospitals, long-term care facilities, and dialysis centers. And healthcare associated pneumonia is, it can be life-threatening, as we know, and we have to be very careful with it, but also Medicare and Medicaid are looking at healthcare acquired infections and making the place that they acquired that infection responsible for it. For example, if you get sent to the hospital from maybe a nursing home with healthcare acquired pneumonia, Medicare, Medicaid may look at that nursing home and say, okay, what are you doing that these people are getting pneumonia? So that's the difference between community and acquired. And then we have ventilated associated, and that's what we're working on with COVID-19. Ventilated associated pneumonia is when someone gets pneumonia after being on a ventilator, and that's a machine that's, we all know, that supports breathing. The bacteria and viruses that most commonly cause pneumonia in the community are different from the healthcare settings. So again, the ones that are in the healthcare settings are usually more virulent. And this seems to be a real issue, like I said, with COVID-19. You hear of people being on ventilators and then not coming off of them. The other thing, and just kind of going off topic for a second, with COVID-19, what happens is they get dependent on the ventilator, and then it's really hard to remove them. So it's called adult respiratory distress syndrome. And it's once you get an adult on a ventilator and they stay on the ventilator for a long time, it's not unusual for their body not to handle coming off of it. And the longer you're on a ventilator, the higher your risk is of contracting pneumonia. Symptoms of pneumonia are fever, chills, cough, rapid breathing or difficulty breathing, chest pain, and again with our older adults, confusion or decreased alertness. And sometimes that might be our first, kind of red flag. in a community setting where we see a change in behavior or a change in cognition with someone, we look to 2 infections almost immediately. One would be a urinary tract infection, and the second one would be an upper respiratory infection, such as pneumonia. It's not uncommon for people to complain of chest pain when they're having symptoms of pneumonia. So let's talk a little bit about the pneumonia vaccine. The one that's recommended for older adults is the PPSV23. All older adults, 65 and older, should get the PPSV23. People who are ages 2 to 64 with particular medical conditions should get that same vaccine. And then adults 19 through 64 who smoke cigarettes should also get the PPSV23. Medicare Part B will cover 100% of the cost for both of the pneumococcal vaccines, but they have to be administered at least 12 months apart. So you get one, and then a year later you kind of get that booster. Okay, so that's kind of how that works. The second dose of PPSV23, like I said, 12 months apart, but there's another type of pneumococcal vaccine called PCV13, and that is recommended for certain other high-risk groups. Your healthcare provider will know exactly which one to give you based on your age, your comorbidity, your medical condition. And if you've already had one dose, you definitely need to get the other one. So I'm actually going to get my second pneumonia vaccine next week. I got my last one about a year ago. Okay, our next one up is herpes zoster or shingles. Shingles is a painful rash that develops on one side of the face or body. The rash consists of blisters that typically scab over in about 7 to 10 days. And it usually should clear up in about 2 to 4 weeks. Anyone who has had chickenpox in the past can develop shingles. Even children can get it. The virus that causes shingles, the varicella zoster virus, the VSV, can spread from a person with active shingles and cause chickenpox in someone who never has had chickenpox or received chickenpox vaccine. So if you've had varicella zoster, and that really should be varicella, not herpes, but if you've had varicella, if you've had chickenpox, then you can get shingles. However, if you've not, you're probably not going to get shingles, but you can get chickenpox. So if you've never had that, you need to talk to your healthcare provider about getting a chickenpox vaccine. The virus that causes shingles spreads through direct contact with fluid from the rash that turn to blisters. Most people who develop shingles have only one episode during their lifetime, and they typically never want to have it again. However, you can get the disease more than once. A person with active shingles can spread the virus when the rash is in its blister phase. So when the rash is in a blister phase, if it's an area that you can't cover, you really should isolate because you don't want any of that oozing fluid, excuse me, to contaminate anybody else. Once it crusts over, you're no longer infected, okay? If you've had shingles, you know that the herpetic pain that you get with it can be extremely uncomfortable. And some people will experience what's called post-herpetic neuralgia, and that can last for years. So herpes zoster, or varicella zoster, I should say, is something that you really don't want to get. I can remember when I worked in the eye clinic at Loyola, and we had a young man come in. He had shingles on the side of his face, and it went into his cornea, and he was in extreme pain. I can remember giving him a shot of 100 milligrams of Demerol, and it didn't even touch his pain. When it goes into the eye, it's a pain that's unrelenting. Typically, shingles follows a nerve path. So that's why you'll typically see it around the eye and goes down the side of the face, or you'll see it around the waist, because there's nerve, anywhere there's nerve paths, that's where you can get shingles. So again, you have to be really careful with that. Some people will have an itchy, burning feeling before they actually get the rash. Some people will have pain or itching or tingling where it's going to develop, and then that'll be about several days before the rash appears. And some people experience fever, they experience headache, they experience chills and an upset stomach. Now I don't get that, but I do get cold sores, which is the same virus, and I typically get those. And again, normally it happens when my immune system is bottoming out. And so I start to feel fatigued about a day before. I start to feel the itching and the burning. And then I start to feel that tingling, itching, and burning right around the area that I'm going to get it. And there are some antivirals on the market that you can use for the cold sores. And if you can catch that right away and start working on it and putting on that cream, it usually will cut the time and the severity of that cold sore. It usually won't work on the body rashes that you get. There's antivirals that will work on that. So it's a little bit different how they work. Complications, post-herpetic neuralgia. And again, I've heard people have that for up to 7 years. And even though the symptoms of the disease are gone, you don't see a rash, you don't see the crustiness anymore, people will experience nerve pain. And it can be extremely uncomfortable. Some people can get pneumonia because it goes to the 6th cranial nerve, which is around, the side of your face and near your ear. Some people end up with hearing problems. Rarely you can get encephalitis. And some people can die from complications from shingles. Very rare, but it has happened. Whoops. I just lost my, okay. So let's talk about a shingles vaccine. Anyone 50 years or older. The name of the vaccine is Shingles. The dose advised. There was a 1st generation vaccine out there. What they found was the reaction that people were having, plus the immunity it was building, wasn't adequate enough. So they went back to the drawing table and they developed Shingles. So they're saying if you got the 1st generation of the shingles vaccine, you should go back and get this. It is a 2-dose. And you get it, 2 doses, 6 months apart. It is covered by Medicare. And again, getting the shingles vaccine, if it does anything else, it's going to help protect you against the post-herpetic neuralgia. Some people get the shingles vaccine and they still may get shingles. But typically if that happens, they won't have the post-herpetic neuralgia, and secondly, they'll have more of a subclinical case. It won't be as active and virulent as you may have without the vaccine. So that's the three vaccines that I will address today. Like I said at the beginning, if you have a topic that you'd like me to talk about for the month of November, please put it in the chat box and we'll open up for any questions now.
I think you were very succinct with all of your explanations, and so interesting with everything happening in the world now with COVID and a cure and all these years it took to perfect all of these vaccines.
Right. I did hear, and not to bring politics into this, I just want to let people know that I did hear yesterday, or I read yesterday, that that one medication, the Regeneron, is that President Trump used, is $100,000 a dose. So that would be wonderful if our government was able to give that out, but I'm skeptical of that because of the price of it. Unless drug companies bring that down, it's probably not going to happen.
Mm-hmm. A lot of those plasma treatments, just in terms of, plasma treatments in terms of vaccinations, and do you have any idea if someone does get plasma treatment and then has a vaccine, if it's more effective or not?
I don't know. That's a good question, Barbara. I'm not sure about that.
Mm-hmm.
I know plasma treatments have been used for years. There's always been talk about Mick Jagger going to Germany and having a total transfusion every now and then, which is why he still can do what he does. So I don't know how true that is. Hopefully there'll be a documentary on it someday, but not while he's living, for sure. So I know in other countries they use plasma treatments as such, but I don't know what they do here. I just heard, so my daughter, when her second daughter was born, she decided, because they weren't sure about blood dyscrasias in her husband's side of the family, they decided to take the cord blood and store it. And so, and I did that. I actually paid for that and said, that's my lifetime gift, because you never know, if someone in our family gets leukemia or if we need stem cell. And so they send me, updates every month. And then once a year I get a bill for storage. But anyways, yesterday they were saying they are starting to use stem cell, cord blood stem cells for the treatment in ALS. That's awesome.
Wow.
They can figure that one out. That would be awesome.
Very much so. Yes.
Mm-hmm.
Lou Gehrig's piece. So anyway, well, for our first Ask the Nurse, we are super grateful for this great education. And to my personal bookkeeper, thank you for sponsoring with us. Do you have a question, Lisa?
I actually do.
Okay.
For Chris. Are there side effects to the shingles vaccine?
So I'm hoping to get those before this next, I just got my flu shot. But anyways, I know with any vaccine and it's not a live virus from what I understand, this one is not. So when it's a live virus, there's always more complications, but not a live virus, you have less. But I know that some people will feel fatigued and they might feel a little feverish after the shingles. I have gotten the hepatitis because I'm a healthcare worker, and I noticed when I got both of those, obviously the sore arm always, but I did feel fatigued about 24 hours after that. So,
I had both shingles vaccines on the last year and a half, and I had not an issue. Maybe my arm hurt a little bit, and I did them about 5 months apart.
Okay.
So I got on lists at a couple of the Walgreens and CVS, and one was done in Grays Lake and one was done in Winnetka.
Right.
Yeah.
It's whoever had it, but no, I had no problem.
Okay, good to know. Yeah, I had heard there was also, prior to COVID, a shortage. Everyone was running to get their shingles vaccines. So, but it's on my list.
Can you do your flu vaccine and your shingles vaccine at the same time, like in the same appointment, or do you have to separate them?
The shingles and any, I always recommend getting all vaccines one at a time. So if you're having a reaction, what you're having a reaction to. I hated when my kids were younger, when they would get like the MMR, and those can be divided doses, but when they get the MMR, if they had a reaction, you never knew what they were acting to. And actually that happened to my granddaughter. She got her first MMR. It was my daughter's first child. That she has 2 daughters. And she had, I still have a picture of it, from her knee to her thigh, from the inside of her thigh to the outside of her thigh was completely red, swollen, with like a 5 centimeter center hardcore knot. And ever since then, and I told her, I said, you know, Beth, you can request divided doses on this. You don't have to have them. And that's all she's ever done since then, is the divided doses. So I don't like getting or giving more than one at a time, because you just don't know what you might be reacting to.
Yeah, that makes sense. Thank you.
So,
On my to-do list also.
yeah. I know, you know, the other herpes one that I'm glad I don't have any young kids, because that's really a hard one to consider if you have younger children, you know, 13 and 14, 9-year-olds, you know, what do you do about that? I don't know, you know,
Exactly.
scary world out there.
Very much so.
Do you guys have any, have you given any thought to anything you think older adults would like to hear about next?
Well, we can talk about all of that for purposes now. We're grateful for being live, and for all of those that have taken in this wonderful information on Facebook Live. We're going to complete this thanks to our partner at Arborea for being on here with us. They put it on their Facebook, so we're super appreciative for that. Thank you, Jeff. And thank you to everybody. And we will have discussion further on. If anyone would like to contact Elderwerks, 847-462-0885, and let us know whether or not you have a specific topic you want to talk about. Please let us know. Thank you, everyone, for joining us.